Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I am very excited to bring back Dr. Joe Anzaldua from last week. Just to refresh your memory, he's been practicing medicine in the Sugar Land area since 1985. He has been with Oak Bend Medical Group since its inception. He is board certified in family practice and a fellow with the American Academy of Family Practice. He is currently with his private practice. He is medical director of the emergency medical services for the cities of Sugar Land, Stafford, and Missouri City. He has been appointed to serve as the health authority for the cities of Stafford and Missouri City, Texas, primarily to serve as a consultant to deal with COVID-19 pandemic. He has also served on many appointments. He is a member of the Houston Symphony Choir and an Advis cyclist, an amazing physician with a passion for patients and a good health care. Welcome, Dr. Anzaldua.
Well, thank you for having me back.
It is great to have you back. For those that didn't get to see last week's episode, please, you can go back and you can listen to it. We covered COVID and traveling. But what we did hear from our listeners was people want to know specific questions just about traveling. And so we won't be covering the COVID part of it, but we'll talk about other problems or other issues we need to consider when traveling. Dr. Anzaldua, can long-distance air travel affect our health?
Well, the most significant negative effect is on our circulatory system, where the cabin pressure can place undue strain on blood flow. So the length of flying time and limited movement are important factors here. One of the biggest health concerns is something called DVT, or deep vein thrombosis, where blood clots form in the legs. If a person is at risk for DVT or even has a history of having had DVT, they should consult their healthcare provider to make sure that they are fit for travel. If they can fly, they should consider walking around the cabin every 1 to 2 hours on those long flights across the pond. They should also ask their doctor about possibly wearing compression stockings during the flight. The stockings are easily available at most medical supply stores and even pharmacies. Also, people need to keep in mind that cabin air tends to be relatively humid, or lack of humidity rather, predisposing travelers to dehydration. So we do recommend drinking a lot of water. Again, the air tends to be relatively less humid compared to regular air. So in general, air pressure drops as a jet gains altitude, and also as jet descends, air pressure does rise. Changes in air pressure can cause and affect oxygen levels in a person's body, which can have a negative impact on people, especially those that have lung disorders or even serious heart problems. Again, check with their healthcare provider to make sure that they are fit for travel, especially if they suffer from such conditions as COPD, asthma, heart disease, heart failure, etc.
So it'd be good to get checked up before you go on a long trip.
I would say so, yes.
Now, when you travel those long trips, sometimes you lose sleep due to the traveling. What negative health effects can that have on my health?
Well, there's some studies that suggest that a disruption in our circadian rhythm, that's our biological clock that makes us wake and makes us sleep, that sometimes sleep deprivation and jet lag can have a negative impact on our immune system. And sometimes that negative impact on our immune systems can make us vulnerable to certain illnesses, especially infections.
So, is there anything that we can take or do to help us get that sleep back or get our rhythm back?
Well, yes, there's biofeedback. People can listen to music on the plane, read a book, just take it easy and relax. Sometimes people can relax just enough to make them fall asleep. There are some people that just can't fall asleep on a plane and may require some medication. There is medication for things like that. And again, they should check with their doctor to see if it would be advantageous for them to take medication to help them sleep while they're on the flight.
I've heard of some people talking about when they fly and they can't sleep on the plane, they take melatonin. What is your take on melatonin?
Melatonin may be effective. Melatonin is generally used to help people fall asleep. It may be of some help. It doesn't work for everybody. It's great if it works for some people, but not everybody. So in those situations where melatonin doesn't work, again, I would recommend checking in with the healthcare provider to see if there's other medications that can be used as sleeping aids.
Okay. So I know when I've traveled, the older I get, the more stressful it becomes because it's like you got to take a pharmacy and not forget all these things. And how am I going to water the plants? And do I have enough medication? Oh my goodness. Does that kind of stress have a negative health effect on our body or our immune system?
Yeah, I think preparing for long flights, especially you're packing, you're planning, you got to get your passport in order. You got to get to the airport on time. You got to make travel arrangements to get to the airport. You got to go through security, so on and so forth. A lot of this can be physically and emotionally taxing to a lot of people. And I think that physical and emotional stress can have a negative impact on our immune system, especially. And in turn, like I said before, any negative impact on our immune system can affect certain things like cause medical illnesses, including infections.
Okay. What about changing of temperatures and weather climate?
Yeah, well, it's believed that temperature changes do have an impact on our immune system and overall health and our metabolic processes in our body. But the mechanisms of how that happens is not well understood. So that's the best answer I can give you.
Okay. Are there any other factors involved with travel that you think of that can weaken the immune system?
Well, other than sleep deprivation and jet lag we talked about, I think a person's general health is also a big factor, especially if people have certain medical conditions that are associated with weakening an immune system. I also think that individuals that are not properly hydrated while flying are at risk of weakening the immune system. So, like I said before, it's best to always stay hydrated even before air travel. Avoid such things that can dehydrate you, like caffeine or alcohol while flying. About sleep, a lot of people do tend to use alcohol as a medication or a way to help them fall asleep, but I would discourage this because in the end, it probably will cause more harm than it does good. So remember, drink a lot of water and to avoid caffeine and alcohol while flying if at all possible.
Okay. When we're traveling, specifically flying on a plane, we are obviously sharing a confined space with a lot of other people, making it easy for germs to spread. What are your thoughts on how easy it is to get sick when traveling, and what are some of the ways to avoid catching something?
Well, commercial jets are not always properly sanitized in between flights. Some of the areas at high risk for harboring infections include toilet areas, tray tables, armrests, and seat pockets. Believe it or not, tray tables may look clean, but they may actually harbor more germs than even the restroom area. The best way to avoid contamination is to minimize hand contact with these areas just mentioned and to carry a bottle of hand sanitizer or a package of baby wipes to keep hands clean and germ-free if possible.
Okay. So, what other recommendations do you have to help prepare and make situations easier in the future when we travel?
Well, the best thing to do is to be prepared, especially if the person has serious medical conditions. Research the area that you'll be traveling to. A good idea is to check the CDC website, especially if you'll be visiting areas with current high rate of coronavirus transmission, visiting underdeveloped or impoverished countries where healthcare facilities may not be readily accessible. There are many travels with significant medical conditions, especially those with cardiac, respiratory, cancer, and even immunity problems. So they should check with their healthcare provider to make sure that they're fit for travel and to see if they will need any extra precautions to take, including vaccinations. The next thing I would recommend is check in on healthcare insurance to see if you're covered abroad. If not, people may need to purchase separate medical insurance that covers them while they're engaging in foreign travel. They should investigate the healthcare system of the places that they're traveling to. They should take note of hospitals that are close by, emergency rooms, and clinics. A very common mistake is forgetting to pack your prescription medications. So I would recommend making sure that all prescriptions are packed and that there's enough medication available while they're away, as these medications may not be available overseas, or at least hard to find. All prescription bottles should be properly labeled. It's also a good idea to write down a list of all your medications, including any allergies that a patient may have, and the names and telephone numbers of all the healthcare providers. Along with medications, it's a good idea to pack over-the-counter medications such as Tylenol for a headache or fever, motion sickness medication for cough, allergies, diarrhea, etc.
So I've done all this and I'm going to do all this and I get sick anyway. Can you give us some points of what to do if we're truly sick?
Well, yes, unfortunately, there are people that do find themselves sick when they travel abroad. Many hotels abroad realize that their traveling guests may get sick. For this reason, people should check in with the front desk at their hotel to see if arrangements can be made for a physician to attend them should the need arise. In addition, people may wish to contact their own personal physician, but they should keep in mind that their assistance may be somewhat limited. They can still provide some medical advice and recommendations for certain medications that they may be able to find at a local pharmacy.
So some common travel illnesses, be it in the air, just traveling, or on a cruise, are motion sickness, food poisoning, cough and cold, and sunburns. Could you briefly describe some of these symptoms and how it can be treated?
Well, motion sickness is a common ailment that may present during actual travel and even before people arrive at their destination. Sometimes nausea and even vomiting can be associated with motion sickness. There are over-the-counter preparations that may help with these symptoms, but people should also avoid overeating, excessive consumption of alcohol and caffeine. Again, people should ask their healthcare provider for recommendations or advice on medications or precautions they can take. Food poisoning is another common problem that's encountered during travel. So people should be careful and choose wisely the locations where they decide to dine. Dining at a hotel is always the best bet. If at all possible, people should be drinking out of bottled beverages with bottled water, for instance. Diarrhea is a common manifestation of food poisoning. Again, I do recommend consulting with a healthcare provider to see if taking a medication or a prescription of an antibiotic would be advisable. In many cases, though, antibiotics are not necessary and may actually make conditions worse. In certain cases, Pepto-Bismol may help, but again, they should consult their healthcare provider to make sure that they can take this. If a person should develop fever, abdominal pain, bloody stools, or dizziness associated with food poisoning or diarrhea, they should seek medical attention, as these are red flags that something more serious may be going on. Cough, colds, and allergies are very common ailments when traveling. There are many medications available now over the counter, again, not requiring prescriptions. People should again contact their healthcare provider to make sure that they get the appropriate recommendations and instructions on specifically what medications they can use given any medical conditions that they may have. You mentioned sunburns. Well, overexposure to the sun's dangerous ultraviolet rays can cause a condition we know as sunburn. People should consider wearing sunscreens with a sun protection factor, an SPF of at least 15 when traveling to places where the sun may be very intense. People should apply and reapply maybe every 2 hours. And again, people should check with their physicians prior to travel to see what recommendations they may have to prevent this.
Awesome advice. Any other additional suggestions?
Well, just in general, I would say at number one, anticipate and plan ahead. Number two, hydrate, hydrate, hydrate. Number three, avoid excessive amounts of alcohol and caffeine. Number four, use hand sanitizers often, preferably those that contain at least 6% of alcohol. Number five, wearing face masks. Number six, avoid travel or contact with others by social distancing, especially in crowded settings. And above all, number seven, rest.
Awesome information. Dr. Anzaldua, you're located in Sugar Land off of Highway 90A, and you are taking appointments from patients, and you take just about every insurance, correct?
Pretty much, yes. Yes, we are accepting new patients as well.
Dr. Anzaldua, thank you so much for being with us again today. Your information is invaluable for all of us that hope to get back to traveling soon.
Well, thank you for having me.
Thank you also to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week. Thank you.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.